NAMI, National Alliance on Mental Illness. What is NAMI? For 30 years, NAMI has been the most powerful mental health organization advocating for mental illness in the country. NAMI New Hampshire is dedicated to improving the quality of life for those who are affected by mental illness. What is mental illness? Mental illnesses are brain disorders. Mental illness doesn't mean there are defects in someone's personality, and they are not a sign of poor moral character or a lack of faith. Mental illness does not mean that someone is a failure. 5 million people in the United States suffer from some kind of serious or chronic brain disorder. Chemical imbalances in the brain for unknown causes are usually the reason for symptoms of mental illness. Genes, which are genetic highways of information, can also be the cause of mental illness. Families oftentimes pass certain illnesses onto their offspring through genetics. Types of mental illness. Major depression. Major depression is a serious medical illness that affects 15 million Americans a year. Major depression isn't just having a bad day, it is a long-lasting sadness. Major depression affects a person's thoughts, behavior, mood, activity, and physical health. Major depression is the most disabling illness in America. Without treatment, the seriousness of depression worsens. Bipolar disorder. Bipolar disorder is an illness that causes extreme shifts in mood, energy, and functioning. Over 10 million people in America have bipolar disorder. Bipolar disorder is usually a lifelong illness. Medication may be the key to treatment, but psychotherapy, support, and education are also important in treatment. Bipolar disorder is usually passed on through families. Panic disorders. Imagine you are driving home from the grocery store and suddenly things seem to be out of control. You feel hot flashes, things around you blur, you can't tell where you are, and you feel as if you're dying. What's happening? This type of scenario is caused by a panic attack. A person who has panic attacks regularly are more prone to being diagnosed as having a panic disorder. Panic attacks often feel like one is dying, choking, sweating, having hot flashes, etc. Chemical imbalances, hormonal imbalances, drugs or alcohol, stress, and other events can lead to panic attacks. Panic attacks are often misdiagnosed as a heart attack, heart disease, or respiratory problems. 2 to 5% of people are affected by panic disorder. Panic disorder can be passed along in families. Post-traumatic stress disorder, or otherwise known as PTSD, is an anxiety disorder that can occur after extreme fear of helplessness. PTSD can be caused by rape, abuse, serious activity, etc. People with PTSD experience the reoccurrence of the event they went through, avoid certain people, thoughts, or situations related to the event. People with this disorder can't function as well as they did before the traumatic event they experienced. Symptoms of PTSD don't always occur right away. They can occur years later. Studies show that anywhere from 2% to 9% of people experience some form of PTSD symptoms. The chance of getting PTSD becomes greater when a person is exposed to more than one traumatic event or lifelong trauma. People with PTSD can be effectively treated with the use of medication and psychotherapy. Treatment. Medication. There is no cure for mental illness, but medications are used a lot when it comes to treating a mental illness. Medications are used to correct the chemical imbalance. Medication is the base element of treatment and is critical to achieving positive results for people who are working towards recovery. With medication comes trial and error to find the right medication. People on medication need to take their medication as prescribed. If people who are taking medication miss a dose or stop taking the medication altogether, could end up having a relapse. When someone is on medication, they should make sure to talk to their doctor about how the medication is working for them and how they feel on the medication. It takes about several weeks for a medication to become fully effective. People should give their medication the full time it needs in order to determine if it's working for them or not. Therapy is also another important part of recovery. It's important for people to find a doctor they feel comfortable with. Psychosocial treatments such as psychotherapy, talk therapy, social and vocational training are helpful in providing support, education, and guidance to those with mental illness and their families. Studies show that psychosocial treatments help those with mental illness keep out of the hospital, keep people's moods more stabilized, and improve functioning. With medication, therapy should also be followed to a person's best benefit. Acceptance plays another big role in recovery. People have to be willing to accept the fact that they have a brain disorder. It's important for people to realize that they aren't at fault for their mental illness. People should also remember that recovery is possible. NAMI groups. NAMI has a variety of support groups for consumers, the person with mental illness, friends, and families. Examples of groups: Family to Family, Teen Youth, In Our Own Voice, Living with Mental Illness, Connect, and many more. Family to Family. NAMI's free 12-week course is for family caregivers of individuals with mental illness. What members of the course will learn: up-to-date information on the different mental illnesses, co-occurring brain disorders, and addictive disorders. Up-to-date information about medications and their side effects, along with strategies on how to help someone take their medication as prescribed. Learning to be empathetic towards those who have mental illness. Learning strategies to be able to handle crisis. Focusing on how to take care of the caregiver by learning how to cope with stress, worry, and emotional overload. Strategies on how to find the appropriate services within the community. This is my certificate that I earned from the Family to Family class, which I really benefited from, and I suggest anyone who has a family member who's mentally ill and you don't quite understand them to try and take this class. Teen Consumers. On the NAMI webpage, there is an online discussion group called Teen Consumers. In this discussion group, teens can talk about mental illness and how it's affected their life. In Our Own Voice, Living with Mental Illness. In Our Own Voice was developed for people with mental illness to share their story with others about living with mental illness and their recovery success. The audience is encouraged to ask those who are telling their story questions. The more engaged the audience, the more they learn about what it's like to have a mental illness. In Our Own Voice presentations are given to consumer groups, students, educators, professionals, and more. All the presentations are free. The purpose of this program is to better educate people on mental illness, to offer work opportunities, encourage self-confidence and self-esteem for the consumers speaking, and to focus on recovery and the message of hope. Connect. It takes a community to prevent suicide. The Connect Suicide Prevention Project is a community-based approach to prevent suicide. The program trains community members to play a significant role in suicide prevention. Connect has been designated the best practice program to address suicide incidents. The program teaches prevention, education about warning signs of suicide, intervention, skills for responding to attempts, threats, and thoughts of suicide, and postvention, promoting healing and reducing the risk after a suicide. And honestly, suicide is 100% preventable, and don't ever feel like you have to struggle on your own. Reach out for help. NAMI Walks New Hampshire, September 30th, 2012. Changing minds one step at a time. Stigma, an obvious mark of social disgrace. People with mental illness are weak and stupid. One step at a time, we can raise money and awareness about our need for world-class treatment and recovery system for people with mental illness. We must raise the public's awareness of mental illness as a chronic disease and break down the stigma that keeps people from getting treatment that they need and deserve. Walk details. Reduce the stigma of mental illness and promote suicide prevention awareness. Walk with us. No walker registration fee. Participants are encouraged to collect donations from family, friends, co-workers, and business associates in support of their participation in the walk. All walkers who raise $100 or more will get a NAMI Walks t-shirt and will be entered into a raffle for prizes to be presented on walk day. NAMI Walks is a rain or shine event. All the money raised from the walk is used to support New Hampshire families and individuals affected by mental illness or suicide. Team, Resilient Hope. Captain, Brittany, which is me. Co-captain, Eric. Resilient, recovering readily from illness, depression, and adversity. Hope, to believe, desire, or trust. Resilient hope, being able to recover from an illness or event without giving up the desire to keep on. And yeah, I couldn't read the rest of that. Thanks for watching, and I really hope that people who have seen this will try to donate to a NAMI near them, because honestly it's for a good cause and it makes a big difference. Thank you.